join me in welcoming JooYeun Chang.
Thank you, Melissa. Good morning, everyone. I'm very pleased to be here with you for the 19th National Conference on Child Abuse and Neglect. It's wonderful to be here with so many dear friends, mentors, teachers, and colleagues. I want to also send a special greeting to all of our friends who are participating via live webcast. Melissa said yesterday that this was like a family reunion. And as one of the newer members of the CV family, I want to thank you for your warm welcome to this conference and to the larger CV community. I had the pleasure of meeting with many of our grantees earlier this week and to visit yesterday with a local program that's doing innovative work with mental health providers and the courts to serve infants and toddlers who've been abused and neglected. And I want to say that living in Washington, D.C., where you are surrounded by policymakers and the politicians for whom they work, it's easy to forget about what's happening in the real world. So I just want to emphasize how helpful it is to hear directly from those of you on the ground and to see what great child welfare practice in action really looks like. And to quote Angelo, who said yesterday that it's wonderful to be surrounded by fellow believers. So to Melissa's point, please come and talk to me, share with me what you're doing in the field. I really am eager to learn. And so I also wanted to acknowledge that for those of us who work on child welfare day in and day out, it's good to be among our friends and allies and to know that we aren't alone in our efforts. So I join with my colleagues in encouraging you to make connections with new allies who can strengthen your work and encourage you during those tough moments. I also want to take this time to personally thank all the members of the local host committee, as well as, I believe Melissa told me that there are up to 200 volunteers from this area who are working on this conference. I want to thank you for welcoming us to your beautiful and charming city of New Orleans and for all of your support for this conference. Judging by the participation this morning, I think it's safe to assume that people are having a really good time here in New Orleans. I'd also like to thank Catherine Nolan and Melissa Radowski, as well as the entire OCAN team, for their extraordinary work all year long, but particularly for all of their efforts to make this conference possible. Yesterday, you heard from Mark Greenberg, who is our Acting Assistant Secretary at ACF, that this administration views 2014 as the year of action. So I want to spend a few minutes highlighting 3 action steps that the Children's Bureau will be focused on in this upcoming year. The first is launching round 3 of the Child and Family Services reviews. The second is transforming our training and TA for public child welfare agencies and grantees. And the third is addressing the overuse of psychotropic medication for children in foster care. So the Children's Bureau is starting its next round of monitoring of state child welfare programs, also known as the Child and Family Services Review process. As you may know, we conduct these reviews in partnership with the State Child Welfare Agency to assess the state on a number of outcomes and systemic factors related to child safety, permanency, and well-being. The goal of the CFSRs is threefold. One, to determine what happens to children and families who are engaged in child welfare services, to ensure conformity with federal child welfare requirements, and finally, to assist states in enhancing their capacity to help children and families achieve positive outcomes. I want to start, though, by saying the philosophical underpinning of the CFSR. I know it can be a daunting process for states to go through. We talk a lot in child protection about the need to approach families from a strengths-based model, and we must do the same for one another in the field, right? So we believe and want to move forward from this belief that most state agencies want to do what's best for children and families, but sometimes may lack the information or resources to do so. So for this next round of monitoring, the Children's Bureau is making changes in the process to be responsive to what we heard from you in the field. We wanted to remove elements in the process that didn't provide us with an accurate picture of what's happening to children and families, and also remove elements that were overly burdensome to the state, while at the same time encouraging states to see the CFSR as part of their overall continuous quality improvement process. We've been working with stakeholders on these process changes via conference calls and regional meetings, and I want to encourage each of you to connect with your local child welfare agency partners to learn more about what their plans are for this next round of reviews. Once we get the reviews fully launched, we look forward to keeping the field informed about the progress states have made in their programs, as well as their continuing efforts to improve outcomes and their systems for children and families. We also recently announced that the Bureau will fundamentally restructure how we provide technical assistance to states, local jurisdictions, and tribes. These changes are based on our assessment of our existing training and technical assistance network. This included listening to our stakeholders and reviewing feedback from child welfare systems and TA providers. We also reviewed the literature, talked to child welfare agency managers, professional associations, federal staff, and service providers. So for those of you who may not be familiar, under the existing training and technical network, the National Resource Centers and Implementation Centers were funded to support states, tribes, and courts through a combination of product development and dissemination, training and peer networking events, tailored technical assistance in response to individual requests, as well as multi-year TA projects. With our transformation, services previously provided by National Resource Centers and Implementation Centers will now be incorporated into a new structure for the delivery of training and TA. It will be under the National Capacity Building Center for Public Child Welfare Agencies that will consolidate and centralize services and serve as a focal point for national child welfare expertise, as well as evidence-informed training and TA services for state and territorial public child welfare agencies, including those participating in Title IV waiver demonstration projects. In addition, the National Child Welfare Capacity Building Center for Tribes will serve as the focal point for coordinated and culturally competent training in TA to 4B and Title IV programs in American Indian and Alaska Native nations. In addition to transforming our TA structure for states and local child welfare agencies, I'm really pleased to announce that we will dramatically increase our investment in TA and capacity building for Indian child welfare. The National Center for Legal and Judicial Excellence in Child Welfare will serve as the primary TA provider of training and TA to state and tribal court improvement programs. So, from April of this year to March of next year, our capacity building services will undergo a transition period as current TA awards conclude, new federal opportunities are competed, and newly funded projects get underway. We are working to ensure that all of our TA and capacity building resources are coordinated and grounded in evidence-based and research-informed approaches to training, consultation, adult education, and distance learning. So, I shared how we have fundamentally changed or plan to fundamentally change how we do some of our daily business at CB. I want to close by talking about a really exciting new initiative by the administration that we want to put into action, the many lessons you have shared with us about how to serve our most vulnerable children, and those are children and youth in care with psychosocial needs that are not currently being met. In the President's 2015 budget, there is a new 5-year collaborative demonstration with ACF and CMS to encourage states to promote the use of evidence-based psychosocial interventions to children and youth in the foster care system, and at the same time to reduce the overuse of prescription medications, and ultimately to improve outcomes for these children. The need for action in this area is clear. According to the Government Accounting Office, up to 40% of children in foster care were taking one or more psychotropic medications. Children in foster care are prescribed these medications at higher rates than other children served by Medicaid, and often in amounts that exceed the FDA's guidelines. Deb Darrow said yesterday that the field often knows what to do, we just don't know how to do it. I agree and would add that sometimes we know what, we even know how, but we haven't asked our policymakers to invest in what we know works and how we know it works. So we've learned from systems of care and much of the work that many of you in this room have taught us that community and home-based supports for children with serious mental health needs is more than about money for treatment, right? That it requires investments in training and workforce development. We need workers to have smaller caseloads. We also need to recruit and train specialized resource families. Based on the existing evidence base in the area of trauma-informed psychosocial interventions, we know that we need a large initial investment to expand access to effective interventions. So this proposal says that ACF would invest $250 million over 5 years to build the infrastructure and capacity building, while the Medicaid investment of $500 million over 5 years would provide incentive payments to bring Medicaid, state Medicaid agencies to the table and work with child welfare agencies on this issue together. CB is committed to working with you as a partner in serving the most vulnerable children and families in our community. We have asked for your feedback on some of our most critical functions and have tried to incorporate them to make our monitoring, TA, grant programs, and policies reflect our shared vision while evolving to meet the unique needs and opportunities of this time. The partnerships we have with you are critical for our work moving forward. We know that the federal government cannot and should not do this work alone. So I hope you join us in this year of action as we move forward together to ensure the safety, permanency, and well-being of all children and families in this country. Thank you very much and enjoy the rest of the conference.